Hi guys, Grace here. I hope you're having a wonderful morning. Just wanted to check in and let you know that when you are running your own Google ads and Google calls you with suggestions, those suggestions are not good. Don't follow them. 90% of the time, Google is attempting to get you to spend more money. So they'll make suggestions and they'll kind of make it seem like it's in your best interest. But if you just optimize your campaign by talking to a Google salesperson every few months, you will actually be expanding your reach, and a more broad reach means your money doesn't go as far. So what do I mean when I say reach? I'm not talking about geographic location of where you're targeting. I'm talking about keywords and messaging. And so to really optimize a Google Ads campaign, it's something that you need to know how to do, how to be specific with your message, how to build a specific attractive landing page that has the highest possible rate of conversions, and how to set the budget appropriately and to set it up in a focused way. A lot of times when I take a peek at do-it-yourself campaigns, I see that we can be doing a whole lot more with a lot less money. So I'll give you an example of that so that you could put this into practice. Several of our clients are targeting cash pay or fee-for-service patients with their ad campaigns, and they don't want to be utilizing their budget for anyone searching for a certain PPO provider or Medicaid perhaps. So they really want to have a very specific market. Now, of course, you're going after I'll say quality for lack of a better word, because all humans are quality humans, but you're going after quality, a qualified lead, a very specific type of lead, which means you're not going to see a huge quantity of responses, but you also need a very narrow focus. So in some markets, you can do this with a very low budget. You could be, very, very targeted, and you can use that budget wisely. And I always tell people, we can put $1,000 into this campaign. We can keep it super targeted. And here's the cool thing. If we run, let's say, an exact match campaign, Google is not allowed to show your ad to someone who is using keywords that we don't deem appropriate for your campaign. So we'll come up with hundreds, sometimes thousands of keywords that are very, very, very specific and run an exact match search campaign. This means when a patient searches for out-of-network cash pay, no insurance, dentist, very specific search terms, your ads come up and it uses your budget in the highest and best way possible. So a lot of takeaways here. If you're running it yourself, definitely get a second opinion from a professional, number one. Number two, know what exact matches, know what negative keywords are. Make sure your campaign is truly optimized for these things. Number three, have realistic expectations. If you have a very specific campaign and your click-through rate is maybe lower than a past marketing company, but you're getting more qualified leads, more specific inquiries that are relevant to what you do, more relevant to what you do, then your return on investment will go up, even though your click-through rate looks a little bit lower than it used to. This is also the case when you've got free or cheap offers like dental implants $199, and those patients call and you know that they're not going to be very well qualified. You can get that click-through rate really low, but that's not an indication of how well the campaign is performing. So my last takeaway today is make sure that you are evaluating your return on investment